I want to know what ADD or ADHD symptoms you have that you think I can't link to a visual processing problem. Now, of course, there are certainly going to be some out there, and I am really actually very genuinely curious as to hear what you guys come up with. But when it comes to ADD and ADHD, there are actually countless symptoms that could also be caused by binocular vision dysfunction or visual processing deficiency. And yes, there are absolutely cases of ADD and ADHD that get misdiagnosed. And in the past, neuro and developmental optometrists have kind of said that they can like treat these issues and treat these concerns. But the truth is we are just treating the visual processing problem that was missed and then misdiagnosed. So I want to hear your funkiest, weirdest symptom, and I'll see if I can find a very specific visual processing dysfunction or visual processing deficiency in a very specific skill and literally pinpoint down what could cause that problem. Now, a little bit of leeway is that a lot of things that patients bring to me, a lot of things are tasks. So they'll say like reading. I really struggle in reading. Well, reading actually requires 13 visual processing skills to be operating at the same time. So if you're vague and you say something like reading, honestly, it almost helps me because I could tell you like a laundry list of visual processing skills that could be deficient. I want to hear the weirdest, the funkiest. I've heard things like, I feel like I'm seeing shadows. One of my favorites, because I love this because every patient is kind of like a fun, like Tetris cube that I get to help solve and like figure out from these details. So one of these, the patient said, I know you're going to say I'm crazy. Everyone said I'm crazy. They said I'm imagining this. He said that every time I blink, it looks like a camera shutter and I get double vision. I said, okay, this is a first. So we'll use this as an example. But literally, he said every time he blinks, he gets a double vision. It looks like a camera shutter. Sure enough, every time he blinked, he would lose alignment of one of his eyes, but not in just a horizontal way, but in a vertical way as well. So he actually would see the world. He'd have a single vision. And then when he blinked, one of his eyes would move down. So the image would appear as if it was moving up. So he would see this kind of second movement until he regained alignment. It's kind of like those old school projection screens where like you push the button and the next slide clicks in, and you push the button and the next slide clicks in. It was perfectly visible in the exam. It was measurable into like prism diopters exactly how misaligned he was. So it was one of my favorite ones to like solve, because by the time he got to me, he had seen like 3 or 4 other doctors, including a neuro-ophthalmologist and a neurologist, who all said he was fine because of course his MRIs were fine. But that one funky symptom, I got to really sit there and scratch my head and try to visualize what he saw and sort of reverse engineer the problem. But I want to hear your guys' weird symptoms. Some of the weirdest are truly my favorite. So hit me with them in the comments. I will do my best as I watch my kids this weekend to try and answer and respond to as many as possible. But let's hear those weird visual symptoms and anomalies. Thanks, guys. Bye.